Okay, let's unpack this. Have you ever just stopped to think about the incredible systems working away inside you right now? From the layer on the outside keeping everything safe to the sturdy framework holding you up. Our bodies are, well, truly amazing feats of engineering.
They really are. And it's fascinating, isn't it? We tend to think of these systems as separate things, skin here, bones there, but they're deeply interconnected, each one playing a critical role. Today, we're diving into some of those fundamental building blocks.
Exactly. And our mission with this deep dive is pretty straightforward. We want to give you, our curious learner, a real shortcut. We're aiming to help you understand three core human anatomy systems. First up, the integumentary system, that's your skin, hair, nails, the whole package.
Hmm?
Then we'll get into the skeletal system, your bones. And finally, articulations, your joints. We've looked at detailed anatomical sources, and we're pulling out the most important nuggets for you. The essential functions, some surprising details, and how they actually, contribute to your daily life.
Sounds good. Where should we start?
Let's begin with the biggest organ, the integumentary system.
Yeah.
Most people just think skin, right? But it's so much more complex. We are talking skin, hair, and nails. It's often overlooked, but it's like a superhero layer. Its main jobs. Well, acting as your first line of defense, obviously. Regulating your body temperature, thermoregulation, and even activating a crucial vitamin.
Yeah, the skin's structure is pretty remarkable. It's all about layers. You've got the epidermis on the very outside. That's your constantly renewing shield. Underneath that is the dermis, which is, well, the living core, you could say. And then deeper still, the hypodermis, the supportive base.
Okay, so three main layers.
Right. And the epidermis itself, it's amazing. It's got its own layers. Think of it like this self-renewing fortress. The deepest layer, the stratum-based cell, that's the powerhouse. That's where mitosis cell division is happening all the time, pushing new cells up constantly. By the time they reach the top layer, the stratum corneum, they're basically flat, dead protective cells, ready to be shed. So the skin you actually see, it's kind of a graveyard of cells always being replaced from below. It's incredible.
Wow. And that explains why skin feels different in different places, right?
Mhm.
Like thick versus thin skin.
Exactly. Thick skin, like on the soles of your feet, is built for more wear and tear. It even has an extra layer in the epidermis, the stratum lucidum. Thin skin covers most of the rest of your body.
Okay. And beneath that epidermis, you mentioned the dermis. What's going on there?
Oh, the dermis. That's where you find the really important stuff for structure. It has two layers, the papillary and the reticular. And this is home to crucial protein fibers, collagen and elastic fibers. Think of collagen as the strong reinforcement, gives it toughness.
Rebar and concrete.
Kind of, yeah. And elastic fibers, they're like the springs. They give skin its flexibility, its bounce-back quality. And then the deepest layer, the hypodermis, that's mostly fat and loose connective tissue, insulation and cushioning.
Got it. So layers upon layers, each with a job. But it's not just structure, right? There are special cells, too.
Absolutely. The system is packed with specialized cells and glands. Keratinocytes are the main cell type, forming that tough outer barrier we talked about. Then you have melanocytes. They produce melanin, the pigment that gives your skin its color and protects against UV radiation.
Okay.
There are also Merkel cells involved in sensing light touch. And free nerve endings, those are your general detectors for temperature, pain, gentle touch. But some nerve endings are super specialized, like Pacinian corpuscles deep in the... They're specifically tuned to detect pain. Absolutely essential warning signals.
Right. Definitely need those. And what about glands? You mentioned glands.
Yes. Accessory glands are vital. Sebaceous glands produce sebum, which is oil. It keeps your skin and hair moisturized, waterproof. Then you have sudoriferous glands, sweat glands, two main types. Apocrine, found in areas like armpits, and acrine, which are everywhere. Eccrine glands are key for evaporative cooling. That's how you sweat to cool down. Vital for regulating temperature.
So that's the thermoregulation part.
Exactly. Oh, and don't forget, ceruminous glands in your ears, they make earwax, another protective substance.
Even wax glands, who knew?
Oh.
Okay, so we have this amazing regenerating barrier, built-in AC. But what happens when things go wrong? Skin cancer comes to mind.
Yeah, that's a major clinical connection. The main types are melanoma, which is the most dangerous, basal cell carcinoma, and squamous cell carcinoma. And it's so important for people to know the ABCDEs for checking moles or spots: asymmetry, border irregularity, color variation, diameter larger than 6 millimeters, and evolving any changes.
ABCDE, got it. That evolving part seems key.
It is. Early detection makes a huge difference. Because you want to know if something is benign, meaning harmless, or metastatic, meaning it has spread.
Right. Another common issue is burns, I imagine.
Definitely. Burns are classified by severity, by how deep they go. First degree is superficial, like a typical sunburn, affects only the epidermis. Second degree burns go deeper into the dermis partial thickness. Third and fourth degree burns are full thickness, damaging all layers, sometimes even muscle or bone, much more serious.
And doctors have a way to estimate how much skin is affected, right?
Yes, they often use something called the rule of nines. It's a quick way to estimate the percentage of body surface area affected by a burn, which helps guide treatment.
Practical. And you mentioned vitamin D earlier. The skin actually makes it.
Well, it activates it. Sunlight hitting your skin triggers a precursor molecule to start the process of becoming active vitamin D. It's like your body's own little solar-powered vitamin factory.
That's amazing. A great example of how interconnected things are. And quickly, what about hair? Does it just grow forever?
No. Hair goes through cycles. The telogen stage is basically a resting phase, where the hair stops actively growing before it eventually sheds.
Interesting. Okay, so that's the integumentary system, our outer shield. Now let's move inwards to the framework itself, the skeletal system.
Right. Moving from the outside in. And the skeleton is so much more than just, a scaffold.
Lots more than static bones, yeah.
Absolutely. If we connect this to the bigger picture, it's a dynamic, living tissue. It has multiple vital functions. We think support, protection, movement. But one function people often forget, hematopoiesis.
Hematopoiesis, what's that?
That's the production of blood cells, red blood cells, white blood cells, platelets. They're mostly made inside your bone marrow, a constant silent factory.
Wow. Okay, so bone isn't just hard stuff. What is it made of? How does it grow and change?
Good questions. Mineral-wise, calcium and phosphorus are the big players. They give bone its hardness, its rigidity, and linking back again, vitamin D is absolutely essential for your body to absorb and use that calcium effectively for building and maintaining strong bones.
See, interconnected again.
Always. And think of bone tissue as a constant construction site. There's building up and breaking down happening all the time. This involves four main cell types. You have osteoprogenitor cells, those are like the stem cells for bone. Then osteoblasts, think B for build, they lay down new bone matrix.
Okay, builders.
Right. When these osteoblasts get trapped in the matrix they create, they mature into osteocytes. These are the maintainers, the regulators, sensing stress. And finally, osteoclasts. Think C for carve or maybe consume. They break down old or damaged bone tissue.
Builders and demolishers.
Exactly. This whole process is called remodeling. It's this constant, balanced dance that allows bones to adapt, repair, and stay strong.
That's fascinating. But how do bones form in the first place?
From scratch.
Two main ways. Most bones, especially long bones like in your arms and legs, form through endochondral ossification. Basically, you start with a cartilage model, like a blueprint, and it gradually gets replaced by bone.
Got cartilage first. Right. But some bones, like the flat bones of your skull, form differently through intramembranous ossification. This happens directly within a sheet of connective tissue. No cartilage model needed. And how do bones get longer as we grow? That happens specifically at the epiphyseal plate, or growth plate. It's a layer of cartilage that keeps dividing until you reach adulthood, then it fuses.
Ah, the growth plate. I've heard of that. So bones come in different types too, right? Not just long ones.
Oh, definitely. We classify them by shape. Long bones, short bones, like in your wrist. Flat bones, like the skull or ribs. Sesamoid bones.
Sesamoid?
Yeah, those are bones embedded within a tendon. The patella, your kneecap, is the biggest example. We also have irregular bones, like vertebrae, and tiny sutural bones sometimes found in skull joints. Structurally, we talk about compact bone, the dense, smooth outer layer versus spongy bone, which is inside, lighter, has lots of spaces like a honeycomb. Strong, but not too heavy.
Compact and spongy. Makes sense. And the whole skeleton is divided up too.
Yep, into two main parts. The axial skeleton is the central core. Skull, vertebral column, ribs, sternum. Think of the body's axis. The appendicular skeleton is everything attached to that axis. Your limbs, arms and legs, and the girdles that connect them, the shoulder and pelvic girdles.
Axial and appendicular. Okay.
Yeah.
Now, this raises an important point. What happens when bones get injured or don't develop right? We hear about things like osteoporosis.
Right. Osteoporosis is a major concern, especially as people age. Bone breakdown outpaces bone building, making bones weak and brittle. Osteopenia is like a warning stage, lower bone density, but not quite osteoporosis yet. It really highlights that balance between osteoblasts and osteoclasts we talked about.
It really does. And fractures, broken bones. How does the body fix those? Is it different for kids?
Fractures happen, definitely. And yes, kids' bones are a bit different. They're more flexible, so sometimes they get green stick fractures where the bone bends and cracks but doesn't break all the way through. But the general repair process is amazing. It usually follows 4 phases. First, a hematoma forms basically a blood clot at the break site, stops the bleeding, brings in cells.
Step 1, stop the bleeding.
Pretty much. Then a soft callus forms. It's like a fibrocartilage splint. Then that gets replaced by a hard callus of spongy bone, the body's natural cast. And finally, over months or even years, osteoclasts remodel that hard callus, reshaping it back towards the bone's original form.
That's incredible. Use it or lose it applies here too, right? Like with bed rest.
Absolutely. Bones respond to stress. Weight-bearing exercise stimulates those osteoblasts to build bone. Extended bed rest, lack of mechanical stress can actually lead to bone loss. The body thinks, hey, we don't need this much strength here.
Fascinating. Okay, let's dive into some specifics now.
Yeah.
Axial skeleton first, the skull, spine, ribs. You mentioned features like foramen.
Yeah.
What are those?
Yeah, when looking at bones, anatomists use specific terms for features. A foramen is just an opening, a hole, like the big one at the base of the skull, the foramen magnum, where the spinal cord connects. A fossa is a shallow depression. A meatus is a tube-like channel, like your ear canal. Facets are small, smooth, flat surfaces where bones join. A process is a projection or bump, and a protuberance is similar, a bulge.
Lots of terms. Helps describe things precisely, I guess.
Exactly. And in the skull, you see amazing formations. The zygomatic arch, your cheekbone, is actually formed by parts of 2 bones meeting. The zygomatic bone and the temporal bone, the hard palate, the roof of your mouth. Also formed by parts of multiple bones. And those sinuses, air-filled spaces in the skull bones, they lighten the skull and affect your voice resonance.
So they're not just empty space.
Nope, they have functions. And some cranial bones, like the sphenoid and ethmoid, are incredibly complex shapes right in the middle of the skull. They connect to almost everything else, like keystones holding an arch together.
Keystones. Cool analogy. Okay, moving down the axis, the spine and chest.
Right. The vertebral column. Different sections. Cervical vertebrae in the neck, thoracic in the chest where ribs attach, lumbar in the lower back, then the sacrum and coccyx at the base. The first 2 cervical vertebrae have special names and jobs. C1 is the atlas. It holds up the skull, lets you nod yes. C2 is the axis. It has a projection that the atlas pivots around, letting you shake your head no.
Atlas and axis. Makes sense. How many vertebrae total?
Normally, 33 vertebrae before some fuse in adults to form the sacrum and coccyx. And in the thorax, you have the sternum, the breastbone, in 3 parts. Manubrium, top, body, middle, and the little xiphoid process at the bottom. And the ribs connect back there. True ribs connect directly to the sternum via cartilage. False ribs connect indirectly or not at all. Floating ribs, the last 2 pairs, only connect to the spine.
True, false, floating. Okay. Any really surprising bone facts?
Well, the smallest named bone in your body, it's the stapes, one of the tiny ossicles in your middle ear. Absolutely minuscule but crucial for hearing. And maybe even more unique is the hyoid bone. It's in your neck, under your chin. It supports the tongue muscles. What's weird, it doesn't directly articulate or form a joint with any other bone. It just floats, anchored by muscles and ligaments.
A floating bone. That is unique. All right, let's shift gears to the appendicular skeleton. Arms, legs, shoulders, hips.
Yep, the limbs and their attachments. Let's start up top with the pectoral girdle. That's what connects your arms to your axial skeleton. It consists of the clavicle, your collarbone, and the scapula, your shoulder blade. Then you have the arm bones, humerus in the upper arm, radius and ulna in the forearm.
Radius and ulna, okay.
Then the wrist bones, the carpals. Then the metacarpals in the palm. And finally, the phalanges, the finger bones. You have 14 phalanges in each hand, by the way. 3 in each finger, 2 in the thumb.
14. Wow. Okay, down to the lower body, the pelvic girdle.
Right. Much more robust than the pectoral girdle, built for weight-bearing and stability. It's formed by the 2 hip bones, plus the sacrum and coccyx at the back. Each hip bone itself is actually 3 fused bones. The ilium, the big flared part you feel, the ischium, what you sit on, and the pubis at the front. There's also this concept of the true pelvis versus the false pelvis related to the bony basin shape, which is important in fields like obstetrics.
Okay, strong base.
And the leg bones, the femur, the thigh bone, longest, strongest bone in the body, major weight bearer. Below the knee, you have the tibia, the main shin bone, and the fibula, the thinner bone alongside it. And the patella, the kneecap, sitting out front. Then in the ankle and foot, The tarsals are the ankle bones. Key ones are the calcaneus, your heel bone, and the talus, which sits on top of the calcaneus and connects with the tibia and fibula to form the ankle joint.
Talus is the connector. Got it.
Yep. Then you have the metatarsals, 5 long bones in the arch of your foot. And finally, the phalanges, again, the toe bones, same number as in the fingers, 14 per foot.
It really is fascinating how these individual pieces, the femur, the tarsals, the phalanges, all fit together to make something as complex as a hand or a foot, designed perfectly for movement or protection.
It truly is elegant engineering.
And that brings us perfectly to our final topic, the things that connect these bones and allow that movement, the joints or articulations, the unsung heroes.
Absolutely. Without joints, the skeleton would just be a rigid structure. They're crucial. And this raises an important distinction we need to make when talking about joints. We classify them in 2 main ways: by their structure, what they're made of, and by their function, how much movement they allow.
Structure and function. Okay, let's start with structure. What types are there?
Structurally, the first type is fibrous joints. They're held together by dense fibrous connective tissue. There's very little, if any, movement. Think of the sutures in the skull, those interlocking lines. Those are fibrous joints. Another cool example is gomphosis. That's the joint holding your teeth in their sockets, a peg-in-socket joint.
So strong connections, not much movement. What's next?
Next are cartilaginous joints. Held together by cartilage, as the name suggests. There are 2 subtypes here. Synchondrosis uses hyaline cartilage. These are often temporary, like the epiphyseal plates, the growth plates in kids' bones. They eventually ossify. Symphysis joints use fibrocartilage, which is tougher. These allow slight movement. A classic example is the joint between the 2 pubic bones at the front of the pelvis, or the joins between vertebral bodies.
Okay, fibrous, cartilaginous. What's the third?
The third, and probably most familiar type, is synovial joints. These are the most common and most movable joints. Think elbows, knees, shoulders, hips. Their key feature is a joint cavity filled with synovial fluid, which lubricates the joint, reducing friction. They also have articular cartilage covering the bone ends and are usually reinforced by ligaments. Often have accessory structures like menisci, too.
Synovial fluid, like oil for the joints. Makes sense. So that's structure. What about function, how much they move?
All right, the functional classification. This relates directly to the degree of movement allowed. First, synerthrotic joints. These are immovable. Think syn meaning together. Maximum stability. Skull sutures are a prime example. They're both fibrous and synerthrotic.
Immovable, got it.
Then, amphioarthrotic joints. These allow slight movement. Think like amphibian, living in 2 worlds, stable but slightly mobile. The pubic symphysis is a good example. It's cartilaginous, symphysis type, and amphioarthrotic.
Slight movement.
Okay.
And the last one must be freely movable.
Exactly. Diarthrotic joints, freely movable. All synovial joints fall into this functional category. They allow the wide range of motion we need for daily life. Elbows, knees, fingers, all diarthrotic.
Synerthrotic, amphioarthrotic, diarthrotic, immovable, slightly movable, freely movable. Makes sense. And this is where it gets really interesting, right? The incredible variety of movements these joints allow. It's like a whole vocabulary.
It really is. We have basic pairs like flexion and extension. Flexion decreases the angle of a joint, like bending your elbow. Extension increases the angle, straightening it. Then adduction and abduction. Adduction moves a limb towards the body's midline, like bringing your arm down to your side. Abduction moves it away from the midline, like raising your arm out.
Adduction adding to the body. Abduction taking away.
Good way to remember it.
Yeah.
We also have rotation, turning a bone around its own axis, like turning your head side to side. And circumduction, which is like drawing a circle, combines flexion, extension, abduction, and adduction in sequence, like swinging your arm in a circle.
That's a lot already. Any more specific ones?
Oh, yes. In the forearm, there's pronation and supination. Pronation turns the palm backward or downward. Supination turns it forward or upward. Think holding a bowl of soup.
Soup. Nice mnemonic.
Yeah.
What about the foot?
In the foot, eversion turns the sole outwards, laterally. Inversion turns the sole inwards, medially. Opposition is that special thumb movement, touching the tip of your thumb to the tips of your other fingers. Crucial for grabbing things. And with the ankle, dorsiflexion is pulling your foot up towards your shin. Plantar flexion is pointing your toes down, like a ballet dancer on point.
Dorsiflexion up, plantar flexion down. Okay. And the jaw.
Even the jaw has special moves. Protraction is jutting your jaw forward. Retraction is pulling it back. Depression is opening your mouth. Elevation is closing it. And broadly, we can talk about gliding movements too, where flat bone surfaces just slide past each other, like in the wrist or ankle.
Wow. It's amazing how many ways we can move. What about a really complex joint, like the knee? Any key players there?
The knee is definitely complex. Two crucial ligaments often mentioned are the ACL and PCL. The anterior cruciate ligament, ACL, prevents the tibia from sliding too far forward and helps prevent hyperextension. It's often injured by lateral blows. The posterior cruciate ligament, PCL, prevents the tibia from sliding backward. It's important when doing things like walking downstairs or squatting. It helps control rotation, too. A
Hmm.
real marvel of stabilizing ligaments.
ACL and PCL. Hear about those a lot with sports injuries.
Very common, unfortunately. Which brings us to clinical connections for joints. Arthritis is a big one.
Right. Inflammation of the joints. But there are different kinds.
Many different kinds, yes. Osteoarthritis is the most common, often called wear and tear arthritis. The cartilage breaks down over time. Rheumatoid arthritis is different. It's an autoimmune disease where the body's immune system attacks the joint linings, causes inflammation, pain, swelling.
Autoimmune. Okay.
Gouty arthritis, or just gout, is caused by a buildup of uric acid crystals in the joints, often the big toe. Very painful attacks. And psoriatic arthritis is linked to the skin condition psoriasis, causing joint inflammation. Understanding the type of arthritis is key because the causes and treatments differ significantly.
Makes sense. And other injuries besides arthritis.
Sure. Dislocations, also called luxations, are when bones are forced completely out of their normal position in a joint. A subluxation is a partial dislocation, and sprains involve stretching or tearing of ligaments, the connective tissues that hold bones together at joints, different grades depending on severity.
Luxation, subluxation, sprains. Lots can go wrong, but amazing when it all works right. So, wrapping this up, what does this all mean for you, the learner? We've really taken a deep dive today. Integumentary, skeletal, articulation systems. 3 pillars of anatomy. We've tried to uncover how they work, what they're made of, the challenges they face, giving you that shortcut to the key facts and surprising details.
Yeah, and if we connect this back to the bigger picture, understanding these core systems isn't just, academic knowledge for a test. It genuinely empowers you. You can
Right.
understand your own body better, appreciate how resilient it is, maybe even look at health news or doctor's advice with a bit more insight.
Absolutely. Knowing why your skin protects you, how your bones repair, how your joints move, it changes things.
It really does. When you feel a twinge or notice something, you have a better framework for thinking about what might be going on under the surface.
So here's a final thought to mull over. We talked about these systems, skin, bones, joints, mostly separately. But consider this. Despite their very distinct jobs, they are in constant silent communication, supporting each other, protecting each other, working together seamlessly to let you live your life. How might really appreciating that deep interconnectedness change how you view your own health and wellness moving forward? Maybe you'll never look at your skin or bones or joints in quite the same way again.